Welcome everyone to this infection prevention and control education session. Today's topic is Surgical Site Infection Prevention Bundle. We'll focus on key practices for both preoperative and postoperative care and how each of us can help reduce the risk of SSI. I'm Rakia, and I'll be guiding you through this topic today. Let's begin by understanding what SSI means and why preventing it is so important. Let's start with a quick introduction to surgical site infection, or SSI. An SSI is an infection that happens at or near the surgical incision, usually within 30 days after the operation. If an implant, such as a prosthesis or mesh, is used, the risk period extends up to 90 days. SSIs are among the most common healthcare-associated infections, responsible for about 20 to 30% of all HAIs. That's why understanding and preventing SSI is such an important part of infection control practice. Now let's look at why surgical site infection is so important. First, the impact on patients. When a patient develops an SSI, the wound often heals more slowly and becomes painful. In some cases, it can lead to readmission, reoperation, or even sepsis, which can be life-threatening. In severe cases, SSIs can even increase the risk of mortality. Second, the impact on the healthcare system. Patients with SSI usually need to stay in the hospital 7 to 10 extra days. They often require more antibiotics, which raises the risk of antimicrobial resistance. And the treatment cost can be very high, sometimes double the normal surgical expense. That's why preventing SSI is not just about patient comfort, but also about saving lives and resources. Before surgery, we focus on several key infection prevention measures. First, patients should take a shower with chlorhexidine once the night before and again on the morning of surgery. Next, for hair removal, we should use clippers only, never shaving, and do it immediately before surgery if needed. For skin preparation, use an alcohol-based antiseptic, such as chlorhexidine or povidone iodine. Antibiotic prophylaxis is also critical, the right drug, at the right time, which means within 60 minutes before incision. Finally, we must control patient-related factors, keep blood glucose optimized, treat any existing infections, and perform MRSA decolonization if required. All these steps together help lower the risk of SSI even before the surgery begins. Here's a simple preoperative checklist to make sure all infection prevention steps are completed before surgery. First, confirm the patient has showered with antiseptic, usually chlorhexidine, the night before and on the morning of surgery. 2. Hair removal should be done with a clipper only, and only if necessary. 3. The surgical site must be properly marked and cleaned before entering the operating room. 4. Ensure the appropriate antibiotic has been given on time, ideally within 60 minutes before incision. 5. Check that the patient's blood glucose is optimized, especially for diabetic patients. Finally, if indicated, confirm MRSA screening or decolonization has been completed. This checklist helps the team ensure every preventive step is in place before the operation begins. After surgery, infection prevention continues to be just as important. First, keep the dressing intact for 24 to 48 hours, and when changing it, always use aseptic technique. Hand hygiene must be performed before and after any wound contact, that includes touching the dressing or inspecting the site. Next, monitor the wound daily for signs of infection such as redness, swelling, or discharge. Remove drains and catheters as early as possible. They are potential sources of infection if left too long. Continue to control blood glucose and make sure the patient maintains normal body temperature, since both affect wound healing. Finally, don't forget patient education. Teach them how to care for their wound and recognize early warning signs of infection. These are examples of surgical site infections. You can see different stages and severities, from mild redness and swelling around the incision, to purulent discharge, and in more advanced cases, dehiscence or wound breakdown. Some wounds may also show yellowish exudate, or a foul odor, which are clear signs of infection. As healthcare workers, it's important to inspect surgical wounds daily, recognize these early signs, and report them immediately to the surgical or IPC team. Early detection and timely management can prevent the infection from spreading or becoming life-threatening. This is the post-operative SSI prevention checklist, prepared by the IPC team and meant to be used daily until the patient is discharged. Let's start with the first part, hand hygiene and aseptic technique. Before and after any wound contact, always perform hand hygiene. Every dressing change must follow aseptic technique, and we should always wear clean gloves and use sterile supplies. Next is surgical wound care. Check that the dressing is clean, dry, and intact during the first 24 to 48 hours after surgery. If the dressing becomes soiled or loose, change it immediately using aseptic technique. Inspect the wound daily for any signs of redness, swelling, warmth, purulent discharge, or dehiscence. These could be early signs of infection. Now let's move on to the rest of the post-operative SSI prevention checklist. 3. Drain and device management. Always make sure drain sites are clean and dry. The drainage system should remain closed and positioned below the wound level to prevent backflow. And remember, remove drains and catheters as early as clinically indicated, since prolonged use increases infection risk. 4. Patient risk factor control. Keep blood glucose below 180 mg per deciliter, especially for diabetic patients. Maintain normothermia, and ensure the patient's pain is well controlled to promote early ambulation, which helps recovery. 5. Antibiotic stewardship. Confirm that prophylactic antibiotics are stopped within 24 hours or 48 hours for cardiac surgeries. If infection is suspected, escalate immediately to the treating team before starting therapeutic antibiotics. 6. Documentation and escalation. Document wound condition and dressing changes daily, and notify the surgical or IPC team immediately if any SSI is suspected. Finally, 7. Patient and family education. Before discharge, teach proper wound care techniques, and make sure both patient and family understand the warning signs of infection, such as fever, increased pain, redness, or discharge. Every step in this checklist helps ensure safe recovery and effective infection prevention. Here we can see the basic steps and tools for post-operative wound care. On the left, this is the sterile dressing set. It includes sterile gauze, cotton balls, forceps, and a clean tray. Always make sure all materials are sterile before starting the procedure. In the middle and right images, you can see how the wound is cleaned and covered. Use aseptic technique throughout. Avoid touching the wound or dressing surface with bare hands or non-sterile objects. After cleaning, apply a new sterile dressing, making sure it's secure and not too tight. Finally, as shown in the last photo, check that the dressing is properly sealed and comfortable for the patient. Good aseptic technique protects the wound and is one of the simplest, yet most effective, ways to prevent SSI. Let's quickly review the key measures to prevent surgical site infection before surgery. First, make sure the patient takes a preoperative bath or shower, preferably with chlorhexidine. Second, prescribe the correct prophylactic antibiotic, the right drug, at the right time. Third, avoid shaving. If hair removal is necessary, do it immediately before surgery using clippers. Next, ensure the surgical team performs a proper surgical hand scrub, and finally, use a correct skin antiseptic preparation before incision. Each of these steps may seem simple, but together they form a powerful infection prevention bundle that significantly reduces SSI risk. To summarize today's session, SSI prevention requires a bundle approach, covering both the preoperative and postoperative phases. The key principles include proper skin antisepsis, timely antibiotic prophylaxis, aseptic wound care, and patient education. Remember, every staff member plays a vital role in reducing SSI risk, from surgeons and nurses to cleaning staff and the IPC team. Finally, continuous audits and compliance monitoring are essential to maintain and improve surgical outcomes. Together, by following these bundle measures consistently, we can make surgery safer and improve recovery for every patient. Before we finish, here are the key take-home messages on surgical site infection prevention. First, prevention is a team effort. Every person involved, surgeons, anesthetists, nurses, IPC staff, and even the patient, plays an important role in keeping the wound safe. Second, bundles work best. When we combine actions from the preoperative, intraoperative, and postoperative phases, we achieve the biggest reduction in SSI rates. Third, focus on the key elements. These include proper skin preparation, timely antibiotics, aseptic technique, glucose control, wound care, early drain removal, and patient education. And finally, remember, good infection prevention practices save lives, reduce hospital costs, and improve surgical outcomes. Every small action you take makes a big difference. Thank you all for your attention and participation. Remember, infection prevention is everyone's responsibility. Let's keep working together to make our surgical care safer and our patients healthier. Thank you.